I'm Kevin Childs, and today I'll be presenting my single subject design while concentrating on measurement. Method of measure: Depression, Anxiety, Stress Scale, also known as DAS. For this particular study, I'll be explicitly measuring my subject's stress levels. The DAS is a quantitative measure of distress and is not a categorical measure of clinical diagnosis. Disorders such as depression and stress vary along a continuum of severity. The DAS measures the severity of your disorder. At the end of the questionnaire, your severity of stress will be indicated. 1 through 7 indicating normal stress, 8 through 9 indicating mild stress, 10 through 12 indicating moderate stress, 13 through 16 indicating severe stress, 17 through 21 indicating extremely stressed. The subject will utilize this method to identify or scale of stress before and after 10 minutes of outdoor aerobic activity, walking and running. The DAS scale will also allow the subject to self-report her stresses pre-intervention and post-intervention, providing data that will indicate whether 10 minutes of aerobic exercise decreases stress. The subject will record daily for 7 days in a row. Research shows that physical activity decreases stress. A latter study conducted by Plant found that females who walk outdoors, regardless if they were alone or with a peer, experience a greater mood and satisfaction with their workout than those who exercise indoors. My hypothesis from the research collected will indicate that 10 minutes of outdoor aerobic workout a day will decrease stress. Social desirability bias can be a factor throughout my research due to the subject's current relationship with this researcher. She may provide more socially favorable responses to make herself and the researcher look good. Biases can occur when the subject is consciously and/or subconsciously answering the questionnaire, attempting to make a more favorable outcome. Lastly, the respondent may have assumed that the intervention was meant to decrease her experience levels of stress, which could have influenced her to indicate on the questionnaire that the intervention was effective. Cultural bias can be a factor in my research due to the research being a single subject. She's a 29-year-old Caucasian female. She is educated with a bachelor's degree in liberal arts and a teaching credential from Cal Poly. The participant has been an elementary school teacher for the past 3 years. She considers herself to be fairly in touch with herself and has a good understanding of her feelings and emotions, helping reduce measurement error. Random error can play a role throughout my research due to the lack of time. The subject will be taking a questionnaire 14 times, twice daily for a 7-day period. If an outside factor plays into her stress level, the data can be skewed, creating a random error. The research can avoid measuring error by allowing the subject to answer the questionnaire in a comfortable setting with no distractions. There were many limitations of this study, as is custom for most single-subject designs that generally are viewed as having much less rigor. The following limitations threaten the internal validity of research and completely diminish the level of external validity and generalizability. In identifying the population, or in this case, that one female, there was absolutely no randomization due to the respondent being pre-selected. Furthermore, the sample size was very small, and therefore there wasn't a representative distribution of the population being considered. Randomization and a large sample size are necessary in strengthening the generalizability of the findings. To improve the validity of this research, the researcher would suggest that the duration of the study be extended as to provide a better control of variable impact by the history and other external biases. Lastly, the researcher would suggest that future studies attempt to measure multiple independent variables impacting the subject's perceived level of stress. Due to the fact that outside factors can play a role in my research reduces the reliability of data collected. If the participant has a hard day at work, her baseline stress may get higher, skewing the data. This can also play a role in the opposite direction. If the participant gets a promotion and is elated, the data can be skewed, reducing the reliability of the research. These are the references I used for my presentation. Thank you for listening.